Hi, I'm Dr. Tim Liddy for Liddy Podiatry and Prevention. Today I have a special patient here, and the reason I say that is because we've been through a lot together. We've had to reconstruct his whole forefoot for severe contractures of hammertoe deformity and metatarsal phalangeal joint deformity. He had a prior surgery, if you rotate your foot a little bit, where he actually had an accident where the tendon was cut and lacerated, and another surgeon went in and performed a Dwyer calcaneal osteotomy. You can see the other incision on the other side here. In addition to repairing, instead of repairing the tendon, he sacrificed and did a tendon transfer. You can see the length of the scar here. That being said, over the course of a number of years after this initial injury and repair, the contractures in the toes started to get worse and worse. The flexor digitorum longest tendon was sacrificed and used to substitute into the navicular, and that was held in with a compression screw. So he has good stability in the rear foot, but in the meantime he's had significant deformity in the forefoot. He came to me because his toes couldn't even touch the ground when he stood. There's been an advancement of the fat pad just as part of his morphology, and it just sort of held the toes up off the ground, so really he was kind of sitting up like this. And over the course of a number of years, he eventually sought me out on Instagram and then saw the work we did, came in and had the surgeries performed. Andre, initially you were really not happy. Your foot stung, your workload with being a farrier, shoeing horses. You really started to notice you were uncomfortable to the point that you sought out attention and you came to see us. What was the pain level and the disability like on the left prior to the surgeries that I performed?
I would say I'd wake up every morning with a 3 or 4 pain level, just getting out of bed and stepping on the ground for the first time, and then it would escalate to probably 7 or 8.
Yeah,
towards the
almost every day or every day?
Almost every day.
All right, and how long did that go on for? How many years?
It's been years. I've always worked up on my feet in construction as a farrier, working with horses, so it's never been able to rest in that sense.
And when was the injury here and this surgery performed, the year?
2008.
And since that surgery and the trauma that you had and the repair, it just progressively got worse?
Progressively has gotten worse.
And then on the right side, you also had a similar problem, but you never had any trauma.
Correct.
So the morphology is what it is, but this trauma and then surgical repair certainly accelerated the disability on the left for sure.
Yes.
So we did the surgeries where we did tendon lengthenings, Aiken osteotomy. You can see the incisions of the tendon lengthenings, and you had some postoperative complication in the form of an infection, and I think that was more virtue of the work and the environment that you performed your work in, because you didn't rest very much, right? You went back pretty quick. My surgeries were performed approximately 3 months ago. When we decided to go ahead and do the surgeries on the right foot, we did something called regenerative medicine and repair on the left. So we added PRP, platelet-rich plasma, to the left foot underneath these scars and incisions, as well as some steroid. And what we're trying to do is shrink down the fat pad here. And we did all of that 4 days ago. So from 4 days ago to today, what can you tell me about your left foot in terms of how it's feeling?
It's unreal. I have never seen my foot in this condition where all the swelling's down. I've never seen it so flat. I've never seen all the muscles, the definition of the muscles, the ankles, the bones.
Since this injury, so from 2008, you've had chronic swelling.
Chronic swelling.
This is the first time that you've had no swelling.
And then the swelling on top is also the swelling on the bottom, and I've always been riding on the balls of my feet, and I've had more pain than I could, tell you guys about. And today there was like no pain. This is within the last 4 days after the PRP treatment. And the best part is my toes touch the ground again, and I've got good balance now, and I can hop up and down on this one foot. So
toes touching the ground.
Yeah.
Good balance, and hopping on your left foot after the surgical procedure, 3 months after we performed extensive revision types of surgeries on the left foot. Again, tendon lengthening, hammertoe correction, metatarsal phalangeal joint arthrotomy. replacing the fat pad from an anterior position underneath the metatarsal heads, achinosteotomy to bring this toe off. These toes were just tightly packed together with soft tissue contractures. Go ahead and just step down and place your foot on the ground on this white sheet. You okay with the left?
Yeah.
You're just be on the heel.
Yeah.
And just place your foot flat on the left. Let me see your balance and just sort of stand straight and tall.
Yeah.
Toes touching the ground, and so your tips of your toes are now touching the ground. Now, when was the last time that you could grab your toes and they could touch the ground?
That I don't remember.
You can't even remember so long ago.
I was a child.
That's dramatic. Thank you so much for viewing our video. Andre, thank you so much for demonstrating your balance and just your abilities. Really appreciate it. And maybe we'll shoot one more video on the right when we're done. Thank you.